Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I am Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Each time on the Dr. Diane Show, we have experts from around the country discussing cutting-edge topics on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. I'm excited today to have Dr. Sean Altman. When it comes to finding the perfect physical therapist, Dr. Altman stands out from the rest. As a doctor of physical therapy and functional medicine provider, Dr. Altman is committed to delivering exceptional care that produces optimal results. Unlike typical physical therapy visits, Dr. Sean dedicates a substantial amount of time, often an hour or more, to each patient. By leveraging his extensive background and expertise, he skillfully identifies the root cause of his patient's symptoms, and from there he develops a comprehensive plan that not only eliminates the cause, but also promotes long-lasting relief. With over 15 years of experience in the outpatient setting, Dr. Altman successfully treated a diverse range of patients, including those with Lyme disease, fibromyalgia, migraines, autoimmune disorders, orthopedic injuries, prenatal patients, spine disorders, chronic pain, neurologic conditions, and even semi-professional and professional athletes. His advanced training is in a wide array of techniques such as dry needling, cupping, myofascial release, and shockwave therapy, empowering him to deliver cutting-edge treatment that sets him apart. So welcome, Dr. Altman. How are you today?
I'm great. Thanks so much for having me, Diane.
Awesome. So I usually like to start these podcasts by finding out a little bit more about you, how you got interested in medicine, and more specifically, physical therapy.
So my interest in medicine started when I was young. I always had a passion for the sciences. And at the age of 16, I actually became an emergency medical technician. And it was through that experience that I really saw the benefit and the rewarding aspect of medicine in terms of helping other people, in terms of life-threatening situations, and just being a supporting force in their lives.
Wow, that's amazing. 16. Cool. Totally cool. So what drew you to physical therapy specifically?
So it's interesting. I was originally pre-medicine in college, and I thought I was going to go to medical school. But when I graduated undergraduate, I was working as an EMT, and I recognized that my father was having a heart attack in the middle of the softball game. I immediately took him to the hospital on the ambulance, and he ended up having triple bypass surgery. And over the next 3 months, my priorities and my life really changed. And I took him 3 times a week to cardiac rehabilitation. I met his cardiac rehab therapists, and I could see the passion and the care that they brought to each of his visits, and the fact that they got to be a part of his recovery. And to be honest, it was inspirational. It was almost like a light bulb went off, that I realized that was something that I could see myself doing, taking an active role in someone's recovery, and being with them, even during their most difficult times.
Wow, that's awesome. Yeah, I mean, scary, but now kind of like it was a catalyst for you finding your calling, which is amazing.
It was, and it definitely got me thinking more about living healthy, and how the body works, and how we just, sometimes we'll take those things for granted. My father at the time was actually in excellent health. And I never would have thought that something like that could have happened to him. but it really, it turned my world around. But, you know, in retrospect, it really put me on the right path, I think.
Yeah. So you're not the typical physical therapist, and I wanted to get into that really early into our show because I think that it's important to talk about how you're different. And we talked a lot about this, and I just love your approach. But let's talk about that a little bit, like why you practice the style, I guess, of physical therapy that you do, and what made you realize that you were different from most PTs.
So coming out of physical therapy school, I learned traditional physical therapy approach. And I trained under Robin McKenzie, who's famous for, we call it mechanical diagnosis and assessment and treatment. And from there, I realized that there was more to physical therapy. There was more to the musculoskeletal system than just the mechanics of it. And as someone who's always had that passion for the sciences and for study, I immersed myself in learning more about other areas of treatment, fascia, physiology, manipulative therapies, dry needling. My goal was really to see as big a picture as I could about the human body, and to see where, you know, where the areas that it might be missing that would prevent someone from getting better. And in this process, I had the opportunity to meet and learn from many different providers, from yoga instructors, pain management providers, nurse practitioners, chiropractors, massage therapists, yoga instructors, and Pilates instructors, and even functional medicine doctors. And, you know, I think that's really shaped what I've turned into over the course of my career, is learning their perspective, and sort of synthesizing all of that into my approach, more of a, you know, combined approach, as opposed to just staying, you know, in my lane, so to speak, and focusing primarily on the physical therapy traditional approach, which is really just addressing the diagnosis, addressing any impairments and functional limitations, and sort of leaving the rest to everyone else.
Right. Well, it's just like most integrative practitioners. I mean, you're looking at things, you're looking at the whole body and
Mm-hmm.
how things that are happening within the whole, all of the different systems could be affecting why someone's having an issue in their knee, let's say, or hip or whatever, or if they've had surgery and now they're doing rehab. You can't just look at that one area and expect that there might not be other things impacting that are causing pain or slowing the rehabilitation process down. So I love that you do that, because that to me makes more sense than just, it's almost like comparing a naturopath to a traditional medical doctor, whereas a traditional medical doctor is probably just going to look at the symptom and write a prescription, or do something for the symptom but not the root cause. But you're looking at the whole body.
And I think that's really where I started to split. I started to realize that the diagnosis on the prescription was not always the source of a patient's symptoms, and it ran a lot deeper. And in the traditional medical model, unfortunately, and this is really how it works, most physical therapy practice, orthopedic groups, hospitals, the physical therapist is really only able to treat what is on the prescription. So if say the prescription is for shoulder pain, then we are essentially instructed, especially by insurance companies, that we can only focus on the shoulder area. If we happen to determine that their shoulder pain is coming from another area of the body,
Too bad.
in those settings, we are actually instructed to send the patient back to the doctor to get a new prescription, which often the doctors don't like anyway. And many of them are hesitant to put multiple diagnoses on the same prescription. So there's just, and for a while I was fighting this trend. I wanted to, I had this passion to try and improve the system. I was actually director of rehabilitation at a hospital in New York, and I was trying to improve the quality of care there, trying to make it more integrative, and they really wouldn't have any of it. They were very resistant to that type of change. And then eventually I realized, well, if the system isn't going to change, I need to put myself in a place where my approach is welcomed. And that's where I found functional medicine.
Right. And that led you to whole body medicine, which is where you're
Yes,
practicing now in
exactly.
Fairfield in Connecticut. So how does, we have a couple minutes before we get to break, but let's see if we can answer this quickly. How does physical therapy fit with a natural medicine practice?
So what, of course, the primary thing is that my version of physical therapy and what I think really most physical therapy should be looking at the entire musculoskeletal system, the entire body, fits with natural medicine because that's how natural medicine works. It's looking at the entire person, the entire body. And then as I learned more about natural medicine, I started to realize that the guiding principles of natural medicine really mesh extremely well with how physical therapy works. Natural medicine functions by 6 basic principles: the healing power of nature, identifying and treating the causes, first do no harm, doctor as a teacher, treat the whole person, and prevention. And in a moment, I'll go into a little bit of depth with each of those. But the moment I learned this, I could tell immediately that this was the right place for me, because that really is how physical medicine should operate.
Yeah, I was going to say that too. You're listing off these things, and I'm thinking, yes, 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 all those, right, exactly, is how any form of medicine should be practiced for sure. And don't even get me started on the insurance companies. When you were saying earlier just about how, like the insurance companies will only cover what the doctor writes a prescription for. And if it's shoulder pain, then they're only going to cover you working on the time that you spend working on their shoulder, when it could be related to something else in a completely different area of the body. It's like, it makes me crazy that the insurance company is dictating how you practice medicine or your trade. It's nuts.
Absolutely. It is very frustrating. I spent a little over 10 years working with insurance companies. Many hours I spent on the phone
Oh
fighting
God.
with companies to
Yeah.
get visits covered for my patients, to get additional visits covered. And it became very frustrating in
I'm
terms
sure.
of
You,
just not being able to give patients the care I wanted.
yeah, I know. I know. This is fascinating. We're going to get into a little bit more. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. We're going to take a quick break. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. Before we continue, I just want to make sure everyone knows how to contact me. You can find me at www.drdianehayden.com or at either of my 2 publications, www.naturalnutmeg.com or www.essentialnaples.com. And you can learn more about Dr. Sean Altman at www.wholebodymed.com. That's WHOLEBODYMED.com. So welcome back, Dr. Altman. We were talking before we broke. You mentioned something about the 6 principles of natural medicine, and you went through them, but I wanted to just revisit that because so many of them resonated with me, like, wow, this should be the 6 principles of any kind of medicine. So do you want to just talk a little bit more about each one?
Yeah, absolutely. And I'll go through them rather quickly. So the first principle is the healing power of nature, which is basically that the body has a tremendous ability to heal itself. And I'll touch upon this later, but basically, given the right circumstances and the right environment, our bodies can heal from a lot of things. There's often just something in the way that's blocking that from occurring. And a lot of natural medicine focuses on identifying those issues, eliminating them so that the person can heal themselves. It's very empowering. The second is identify and treat the causes. And what this really emphasizes is treat all the causes. So looking at the patient as a whole, figuring out any deficiencies that they may have, any issues they may have medically, and addressing those so that anything that is causing their symptoms is addressed right off the bat and they don't have any problems down the line. The next is first do no harm. And you may be familiar with this phrase from the Hippocratic Oath, but natural medicine interprets this a little bit differently, and I happen to really love it. So the way they interpret first do no harm is that a patient should be rehabilitated with the least amount of pain possible. And that should be a focus of their treatment, that you should find any and all modalities that will improve their health and improve their well-being without causing any unnecessary harm. And I think, as Diane mentioned, that really is how all medicine should be practiced. And it's definitely something that we should emphasize going forward. The next is doctor as a teacher. And this is something that is a big part of physical therapy, patient education. And it's something that I emphasize with all of my patients. So an informed patient is a more comfortable patient. An informed patient is going to be more amenable to treatment and feels more involved in their own treatment. So educating a patient on their condition, what's going on, what our approach is going to be to it, and how they can get better is going to make them feel a lot more comfortable with their treatment and with how they progress. The next is treat the whole person. So that's the physical and the psychological. That's addressing anything that may be contributing to their symptoms, and making sure that your plan is as global as possible. And lastly, there's prevention. So prevention is looking at risk factors, doing proactive testing, making sure that a person doesn't have something coming up around the corner. It's actually something that I wrote my thesis on in physical therapy school, which is silent MI, silent myocardial infarction. So I actually wrote this on my father, which is the importance of early testing in people who have a history of, say, heart disease. My father didn't have any evidence of heart disease or any risk factors other than the family history of having a heart attack. But if we had done preventative testing, if we had been on top of it more, we may have caught it sooner and been able to address it in a much more smooth and comfortable manner. And I think that's really important for everyone, is to be ahead instead of to just address problems as they come up.
Yeah, just to divert for a second, because you mentioned this, and I think people are going to want to know the answer to this question. What types of preventative measures or testing would you have done for your dad?
So they have things like they call lifeline screening, which test calcium buildup in your arteries.
Mm-hmm.
And you can actually determine early phases of blockages that are pre-symptomatic. So the person has no symptoms, they don't have any issues on a stress test, but you can start to monitor their blockages and be very proactive in terms of clearing those blockages before they ever create any symptoms. And the same thing exists for many other conditions. These things are just not widely publicized because, again, going back to insurance, they're not always covered by insurance. But I don't know about you, I would rather be comfortable knowing that my family is safe than worrying about the finances of if something's covered or not covered by insurance.
Oh, absolutely. I mean, that's one of like my missions with my magazines, is educating people on why they need to take responsibility for their health, and that, yeah, you're going to have to pay out of pocket sometimes. And why are you allowing an insurance company to dictate the kind of health care that you get? I mean, okay, yeah, maybe some of these things might be more expensive than you thought, but at the end of the day, how worse is it, or how much more expensive is it going to be if you wait till you actually have a health issue?
Agreed, completely
Yep.
agreed.
So you, switching gears, you practice something in your practice called frequency specific microcurrent. And so I'm curious, we're all curious to know what that is, and how did you integrate that into your physical therapy practice?
So frequency specific microcurrent, and I'll refer to it as FSM just because it's shorter, is really a game changer in medicine. What it basically does is it sends electrical signals that are specific frequencies into the body that mimic signals that would come from your brain. Because when your brain sends signals, they're essentially electrical signals as well. And by utilizing this technology, we can send direct cues and signals to the body to produce certain results. And it just needs to be targeted to the right area and to the right condition. And one of the best parts about it is, in addition to it being a treatment, it can also be very diagnostic, because if someone responds to a particular frequency, it is highly indicative that that is the issue that they are dealing with. And one of the biggest things that it has changed in my practice is the ability to treat diagnoses that in most cases medicine has said are essentially untreatable, and have just said that you can really only do palliative care. A number of the hallmark studies for FSM that date back to 20 years ago involve fibromyalgia. Fibromyalgia is chronic hypersensitivity of the nerves that can come from a variety of sources, but essentially your nervous system is in a hyperstimulated state. So you experience nerve pain that is disproportionate to the actual compression or irritation of the nerves. The FSM has the ability to reset and recalibrate your nervous system to cure, or at the very least, significantly improve fibromyalgia. And I've seen this in many, many patients, myself included. I'm actually someone who happens to suffer from fibromyalgia, and I felt a huge improvement in this. And this is not a modality that's just temporary. Once the results have been achieved, the nervous system continues to function the appropriate way.
Wow, that's amazing. What other types of conditions have you used it for?
We've used it on, it's very good on scar tissue. It has the ability to stimulate repair in areas that are damaged. One patient that comes to mind that's actually really interesting in terms of the scar tissue. So I had a patient who is 64, and she has had a history of multiple sinus surgery. She had 3 sinus surgeries by the age of 21 that caused a lot of tightness and scarring on the right side of her face. All the cosmetic stuff was addressed, so like she doesn't have any like visible scars, but the internal scars were clearly there. And the resultant thing from that is that it caused her head and neck to tilt and rotate toward one side, so it affected her posture. And then 40 years later, it had actually created a bit of a shift in her entire spine. So not only were her head and neck shifted, but her body was actually shifted a little bit to one side. Using the FSM, we were able to break up the scar tissue from those prior surgeries, restore the mobility in her face, her neck, her spine. And then here's the really cool thing. I was able to send a signal into what's called the vestibulospinal tract. So there's a system that connects your vestibular system, your inner ear, with your spine that tells you about posture. And because of her chronic condition, that system was off. It was calibrated. Like when her head was tilted and rotated, she honestly thought she was neutral. And when I corrected her head and neck into the appropriate posture, she said that it felt extremely weird. We were able to reset that system. And this was a bit out there, but I ran the frequency and I literally saw her body straighten out on the treatment table. Wow. And she stood up in perfect posture. And after a few more sessions, we've been able to maintain that posture, and it's made a huge difference in her life. She had this sinus pain and pressure, headaches, migraines for years that was not really being able to be treated by anyone, because the ENT said it was not sinus. It wasn't sinus. It was really posture and scar tissue.
That is totally amazing. We are definitely going to want to learn more. Unfortunately, we have to go to another break right now, but you're listening to the Dr. Diane Show. When we come back, we'll be talking more about physical therapy and frequency specific microcurrent with Dr. Sean Altman. Stay tuned. We'll be right back. we're back on the Dr. Diane Show with me, Dr. Diane Hayden. I'm talking today with Dr. Sean Altman. He's a doctor of physical therapy. You can learn more about him at www.wholebodymed.com. That's WHOLEBODYMED.com. So we were just talking about a fascinating case that you were telling us about a patient that you'd worked with FSM. And I'm imagining that, just by the way you do what you do, focusing on the root causes, you probably have, hundreds of cases that you could talk to us about today in terms of what the amazing patient outcomes are. So, I'm sure there's a couple that come to mind quickly. Just tell us like what the impact has been for that.
The impact has been huge. I've always had this passion for helping patients who are complex and have had difficulty getting success elsewhere. And I always go back to that big picture view and focusing on the root cause. One patient I worked with recently, a 60-year-old patient who came in with a chief complaint of hip pain. She had seen the orthopedist. They had done some x-rays, and of course she had some arthritis. And they said, okay, well, we could start talking about a hip replacement or a cortisone injection. And she was like, let me try therapy first. Like, I just want to make sure I can't rehab this on her own. This patient actually happens to be a yoga instructor and owns several yoga studios. So she very much wanted to do this on her own and see if she could avoid surgery, because she knew surgery was going to keep her out of yoga for a long time. So I started looking at her history, and after assessing her hip, I just didn't get a sense that her hip pain fit with the level of restriction and weakness I found in the hip. I actually found that both hips were fairly even in terms of their mobility. So I started delving more into her history to look for the true root cause. And I asked her, okay, do you have any other history with that leg? So it turned out that she had torn her ACL in that knee at 17. And then she retore it 10 years prior and had elected to not do surgery. And at the moment, she didn't have any complaints of knee pain, so it hadn't even occurred to her. But by getting that history, I realized, okay, let me start taking a look at the knee. And what I realized was, because of her chronic knee issues, she had no quadricep activation at all in that knee. Basically, we grade strength on a scale of 0 to 5. I rated her at like a 1 at the first session. She was barely able to do any exercise. And because of her high level of fitness and being a yoga instructor, she was able to find ways to compensate and do physical activities without needing to use the quad. But in terms of the influence on the hip, we realized right away that was the reason she was getting hip pain. So she ended up having femoral nerve compression. So that's compression on the nerve that crosses the quadricep muscle. We were able to very quickly alleviate that compression using the FSM, and then began restoring function in her quadricep muscle. And as soon as that started to happen, her hip pain almost disappeared overnight. And it's very interesting because this really goes toward the root cause. So yes, she had hip pain, but it wasn't coming from her hip, it was actually coming from her knee. Once we addressed the knee issue, the hip no longer was an issue. And just thinking about this in terms of how the traditional model would have handled it, if she had, God forbid, had an injection, or even worse, if she had had hip surgery, it wouldn't have resulted in any improvement in her hip pain. And that's something that I've seen over the years, patients getting treatment on the wrong joint, and dealing with unnecessary discomfort and not having any benefit in terms of the outcome.
I was going to say, I know so many people who've had knee replacements and it didn't do anything to eliminate the pain.
Yeah, and most likely that's because the problem is elsewhere. The problem could be, what we call extra articular. So it could be the muscles around the knee joint. It could be their hip. Or in some cases, I've actually had patients with hip or knee pain that's stemming from the lumbar spine, from the low back. It could be a referred pain. So always important to look at the entire person and to be 100% confident that you're treating the right area, before you make any drastic, interventions or do anything that, that might be, a struggle, like something like surgery.
Yeah, it's just crazy. Like how often, I mean, that seems like, well, that's just, the recommendation. You've got knee pain, you've got hip pain. Oh, you got to have a knee replacement, you got to have a hip replacement. And how many people are getting this done and finding out that that's not even the right surgery, not that they didn't, not that it wasn't the right surgery, but that they didn't need surgery. It's crazy.
Yeah, absolutely.
Yeah. So you also, what's unique about your practice, I think, or where you are in terms of the group that you work with, whole body medicine, is that you have right next door, pretty much, whole body dentistry owned by Dr. Mark Brer, who is a biological dentist. And I just wanted to ask you, like, do you collaborate with him at all? And if so, how does it impact what you do as far as your treatment approach?
Absolutely. I've been treating TMJ for more than 10 years. And this has been really a window into the other side. I routinely collaborate with Dr. Brer. It's amazing. I'm able to see radiographs of their TMJ. We're able to discuss what's going on inside their mouth. And in a lot of cases, if there's say a headache history, there's often an upper cervical component, which I'm also able to analyze with their CAT scans. So the 3D, the panoramic CAT scans that they do for dentistry capture the upper 3 cervical vertebrae. And in fact, I'm actually finding that the detail on that is better than an MRI. So I'm able to look at their images and look at the entire person, because TMJ and headaches often come together. And sometimes it's the headaches that come first, sometimes it's the TMJ that comes first, but often both need to be addressed. And through the collaboration with Mark, I'm able to do that very effectively. And we're able to make sure that we're doing all the right things for these patients. One of the things that we actually have noticed recently, and we're starting to put together some data about this. I'll give you an example of a particular patient that came up that got us to start looking at this. So we had a patient who came in with complaints of neck pain, headaches, TMJ pain, and then she also had an issue with heart palpitations when she was lying on her back, resulted in a lot of difficulty sleeping. When we did the imaging, it was clear that she had a very narrow airway, and that she had essentially what we would call an obstructive sleep apnea. But then I consulted on this case with Mark, and I started looking at the alignment of her upper cervical spine, and her atlas, which is our first cervical vertebrae, was sitting anterior, so forward in relation to where it should be. And we realized that was actually causing the obstruction in her airway. And as soon as I started working on the alignment of that level, we were basically able to get rid of her palpitations on the table. And I just had a follow-up with her, and she said that based on the treatment we did and the exercises I gave her for home, that it has continued to improve. Bear in mind, this issue with the palpitations she's had for 5 years. She has seen 5 or 6 cardiologists. She has had echocardiograms done, Holter monitor. Like basically no one had any idea of what was causing this.
So it's related to like decreased oxygen intake?
Yeah.
Really?
Because she was getting, when she lies down, especially when she's sleeping, her airway is cut off, so she's having decreased oxygen making its way into her circulatory system, which causes an increased stress on the heart, and that increased stress on the heart was creating the palpitations.
Wow, wild. I mean, who would ever think of that? Even the cardiologist couldn't figure it out.
Nope, none of them, because this really was I would say it's considered more of a pulmonary thing. But even I don't think a pulmonologist would have figured this out. What Dr. Mark and I have realized is that the upper cervical spine and the TMJ is really like this middle area that doesn't get addressed much in medicine. because dentists focus on the teeth, and then physical therapists or spine physicians, they tend to focus on the middle and the lower cervical spine. So that's really like C4 to C8. And those upper three vertebrae, they like almost get ignored. In fact, when they do X-rays or MRIs of the cervical spine, in order to get the upper cervical spine, you have to ask for a special X-ray or MRI, which is called an open mouth view. And it's actually rarely done, and not every place even does it. So it's like this specific area that's just like ignored in some ways.
That's so interesting. Was she having palpitations any other time other than laying down?
Really laying down or just being in any reclined position where there would be pressure on her neck and chest where gravity was acting on it.
Mm-hmm. Yeah. Gosh, that is so interesting. I mean, I've heard a lot of different things about, people. First of all, I think the connection between dentists and sleep apnea is something that's really not, many people don't know much about that, or that even a biological dentist could, figure that out. I have a biological dentist in Florida that I see as well. And that person was like, when they do the intake for you, she was doing all these things in terms of like manipulating my jaw and looking at the roof of my mouth, the shape of it, all these other things. And, I'm like, why are you doing all those things? And she's like, oh, I could tell if I'm looking to see if maybe you have sleep apnea, or if there's other, like the way that your jaw is formed might restrict the airway, all this kinds of stuff that you go to a regular dentist, you're not going to get any of that. Right. So it's just fascinating how much that a biological dentist does that people are not aware of, and why you would want to go see somebody like that for all of the unique things that they do. But it's pretty amazing just to,
And
to
then
be able to.
this also touches upon the fact that this can be correctable.
Exactly.
There's
Yep.
this assumption in the medical field that all sleep apnea is not correctable,
Right.
that the only treatment that exists for it is to just use a CPAP
CPAP.
machine,
Yep. No,
which
it's correctable.
does address the symptoms during your sleep. But if you have a narrowed airway, that narrowed airway doesn't go away during the day. So you're not getting perfect oxygen exchange. Like your pulmonary system, your circulatory system is inefficient.
We got to
And what
go
are you
to a
doing
short
about
break.
what are you doing about it the rest of the day?
Right. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. We're going to take a short break. When we come back, we'll be talking more with Dr. Sean Altman. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at www.drdianehayden.com. I'm talking today to Dr. Sean Altman. He's a doctor of physical therapy, and you can learn more about him at www.wholebodymed.com. That's WHOLEBODYMED.com. So we just have a little short segment left. I wanted to get into what your thoughts are on regenerative medicine, because I know there's a lot of, I don't know if controversy is the right word, but like a lot of maybe more traditional doctors will say, regenerative medicine is dangerous. We don't have enough research or studies on it. But I wanted to get your opinion, Dr. Altman.
Absolutely. So before I was at whole body medicine, I actually spent a little more than 5 years in a chronic pain clinic, an integrated medicine clinic. And we did a lot of regenerative medicine. And in my experience there, in my additional studies, and especially with the use of the FSM, I've come to realize that regenerative medicine works. It's just the body needs the right signals to make sure that it occurs. The basic principle behind regenerative medicine is to get the person to restart the healing process, because for some reason or another, they have stopped healing a particular area, or they need more, say, like cartilage in a particular area. So the reason the evidence on it is not great is because it's not standardized. So PRP may be standardized, But in order for PRP to work, or in order for stem cells to work, or a lot of the other modalities out there to work, steps need to be taken after the procedure to make sure that the person has the appropriate response to it. In our office, we really take that into account. So perfect example would be a patient I saw, 57-year-old patient with a history of migraines. And his migraines occurred due to what's called atlas instability. So our first cervical vertebrae is called our atlas, and there's a ligament that holds that atlas in place called the alar ligament. This person had a 50-year history of playing competitive soccer. He played Division I soccer in college, and then he went on to play semi-professionally, and then he actually still plays quite competitively every weekend. And he has done a lot of headers in the course of his career. And if you think about it, like the heading motion of hitting the ball puts a lot of compression through your skull and your upper cervical spine. Over time, this has led to instability in that joint. And when that joint goes out of alignment, we have two arteries going through the atlas called the vertebral arteries, and they supply the majority of the circulation, the blood flow to our brain. So if that atlas is out to the left or to the right, it cuts off blood supply, blood flow to the brain. And that can cause symptoms, including headaches, migraines. And in this particular patient, it actually was causing vertigo, dizziness symptoms. And he had in the past seen chiropractors who were able to put the joint back into alignment, but it wouldn't stay because of the instability. And he even tried things like PRP, stem cells, and what's called prolotherapy, which is basically saline in the area. But in all cases, that was ineffective. And it was basically because after those procedures, nothing was done to tell his body that it was supposed to use that material, use that procedure to stabilize the area. So what we did was we actually didn't even need to use the regenerative therapies. I was able to just use the FSM and use the appropriate frequencies to tell his body to thicken and strengthen that ligament. And within a few sessions, we were able to start to feel that ligament become more robust. The stability improved, and by the time he was done, it was extremely stable. That coupled with the appropriate core strengthening and neck muscle strengthening, and he hasn't had any issues since. And he's back to playing soccer, which is obviously the goal with all of my patients, is to get them to return to any functional activities that they want. I want them to be able to return to all the things that they love, and live their life the way they want to, rather than having to limit the things they do because of a condition or an injury.
Yeah. And one of those things that limits a lot of people, especially as people get older, is arthritis. So how would you treat that?
So there's a common misconception about arthritis, which is that bone on bone causes pain. So bones don't really cause pain in most cases. The exception would be if someone broke a bone. A broken bone will cause pain, but the majority of the time, the pain coming from arthritis is from friction. So when there's a lack of cartilage or decreased amount of cartilage and the bones rub on one another, that rubbing creates an inflammatory response, and the inflammation causes pain. So really all we need to do is change the environment so that there is decreased friction. So if we can optimize joint mechanics so that the joint glides and slides in a better fashion, so that would be improving range of motion. If we can improve the strength of the muscles surrounding the joint, thereby supporting the joint. And then we can even improve connective tissue support through FSM. So that would be, say if the ligaments around the area aren't as sturdy, we can improve the thickness and the strength of those ligaments. Once we put all those things together, it really doesn't matter if there's not a lot of cartilage. Now that joint is held up very well supported, and the person will not have any symptoms in the majority of cases. And this really goes back to the theme that I have with pretty much all of my patients, which is you are not your MRI, you are not your X-ray, because that only tells a portion of the story. the body is more than just pictures. The body is dynamic. The body moves. So if we can improve the way the body moves, we can change the way that it functions in space, and we can move around or bypass things that might show up on an image.
So interesting that you say bone on bone does not cause pain, because I hear that the reason why most people get knee replacements is because they've been told, quote, they have bone on bone.
Yeah, exactly. And that really is a misconception. I encourage anyone who has gotten that, that opinion to at least try physical therapy and make sure that they're making the right decision. At the very least, improving the environment around the knee, if God forbid they needed the knee replacement, would significantly improve their outcome anyway. Really, the cases that need knee replacements or hip replacements are where there's like a deformity to the joint. So if the joint is not, if it has like changed its configuration or its shape, like say if your knee is now like bowed, it has like a curve to it, and there's like an unequal pressure on it, and there's no cartilage in that area. So there are specific cases where it may be necessary, but I always advise patients to at least look into the possibility that there may be another option, other than surgery, just to see if the therapy or something else might be beneficial, like regenerative medicine. Often that can add cartilage to an area as well.
Exactly. So we have just a couple minutes before we finish our show today. I want to ask you, what do you see as the future of physical therapy practice?
So what I would love to see as the future of physical therapists practice, and this is something that myself and some of my colleagues have been kind of like pushing for, is for us to become essentially the primary care providers of the musculoskeletal system. What I would love to see is once a year, everyone getting what we have affectionately called a PT physical, where someone sits down with a therapist and we take a look at all of the joints in their body. We assess their strength, their balance, as a means for prevention, as a way to identify any problems that they might have ahead of time, and getting ahead of that curve. A little bit of knee arthritis that might be limiting their knee function, getting at that before it becomes painful is often extremely easy, versus waiting 5 or 10 years so that it's a major problem. So all of a sudden that becomes a much more challenging situation. We think about how we go to a traditional, our primary care for a physical, and we do all this lab work and EKG, and we look at a lot of other stuff, but no one's looking at our body. No one's looking at the joints and the muscles and, the physical body. And I think if we could do that, that would be amazing.
I love that. Yeah. And that makes perfect sense to me. And exactly like you said, we go to the traditional MD to get all this preventative testing and things done. Why wouldn't we do this from a physical therapy perspective? I think that's brilliant.
Thank you.
Yeah, definitely. So I want to thank you so much for being with us today. This was a wealth of information. I'm sure we could spend, another hour plus podcast on all the things we talked about and more for sure. So thank you for joining us today, Dr. Altman.
And thank you so much for having me. This was great. I appreciate sharing my story with you. And I hope that some of the information I shared can help others in their journey.
Totally. Absolutely. It will. And I want to thank all of you for tuning into the Dr. Diane Show. Please join me the first and third Thursdays at 11 Eastern, 8 a.m. Pacific. Next time, we'll be discussing more about the power of thoughts and beliefs and the impact they have on your life. Have a great weekend. I'll see you back here next time. Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on TransformationTalkRadio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.